Hi, Jackie Van Ruler here, and I get a ton of questions about what areas of the face you can work while you're pregnant and what areas you need to avoid. So I'm going to do a specific video today on facial reflexology for pregnancy. So some specific points that will help you out throughout your pregnancy and some of the ones to avoid. Make sure that you are signed up to my Instagram channel because this is where I post these face maps so you can have access to them. So I'm trying to get that out of the light so you can kind of see it, but I do have face maps for a lot of my videos, not every single one of them, but it helps you to be able to follow along with them. The first thing I want to say about pregnancy is that pregnancy is a condition of health. People get very, very worried when they get pregnant about the things that they can and cannot do. And I'm going to tell you that there are so many more things that you can do than you can't. So please don't get caught up in those things that you can't do. When I was pregnant, I was asking my doctor all these different things. He's like, that baby is so protected in there, especially during those that first trimester or so, that, you can do it. You can go horseback riding, you do, I took a motorcycle riding class and stuff during that first trimester, and the baby is very protected. Obviously, you want to avoid things like alcohol and drugs, but if you drank alcohol before you knew you were pregnant, it's probably not going to be a very big deal. So don't beat yourself up about that. A lot of times you have a beer or two or a drink or two when you're pregnant. That's not going to cause long-term consequences. I guarantee it. Women have had glasses of wine or things like that throughout their pregnancy. I'm not advocating for it, but I'm also not going to tell you to stress out about it if you have had that. The first points we're going to do are the kidney points. You can find those by putting your fingers on the corners of your mouth, going all the way up to your forehead, coming down maybe like a centimeter, and you'll feel an area that almost feels like your fingers might be able to fit into. It might be also more stuck or puffy in that area. Either way is fine. But the kidneys are the most important point that you're going to work during your pregnancy. And that's because the kidneys they rule and govern growth and development. So while you are pregnant, you are still growing and developing yourself, still making new red blood cells, new white blood cells, new bone marrow, new nervous system tissue. All of those things you're still doing for yourself, and now you're also making those things for your baby as well. The kidneys are in charge of all of that. So the kidneys, and this is going to be the most important thing I can tell you, they respond to just being. They respond to being relaxed, to turning off your mind, to turning off the stress, to turning off the anxiety. So anytime you have the opportunity to just be, this is focusing on things that are creative, painting, singing, drawing, reading, whatever it is that you can do that turns off the stress response in your body. Your kidneys need that just being, or that turning off the brain and the anxiety and the worry in order to repair and rejuvenate itself. So if that means getting massages, if that means meditating, if that means the number one thing I would recommend doing is finding a pure energy facial meditation practitioner and receiving regular treatments, because that is definitely something that will turn down that brain fatigue or that brain that kind of goes on with all of us all the time, particularly when we're stressed. Next points we're going to do are some relaxation points, so 124 and 34. We're going to come over here halfway up the forehead and about 2/3 way across the brow. You can just go back and forth. You can do circles in this area. This is a point that's going to help to relax your nervous system, releasing the neurotransmitter GABA, which is a very potent nervous system relaxer. Okay, doing that on both sides. Incidentally, when you're doing this on the left side, this is also stimulating the spleen point. The spleen point is the organ known as the mother, and it's about detoxification, strengthening your muscles, keeping the red blood cells that are still active and healthy, and then also recycling those that are not. And of course, you need lots of red blood cells to nourish your baby, to grow your baby's brain and spinal cord, and to keep your baby healthy, as well as to keeping yourself healthy. Okay, next we're working this area on the brow. So you can work right here where the brow begins. This is relaxing the shoulders. And also increasing that deep relaxation effect of that 0.124. Doing that on both sides. Noticing if you're starting to carry a lot of shoulder tension. That can definitely happen as you grow, as your stomach gets bigger, as you're gaining weight. Can cause some stress on your shoulders. And then we're going to work from the center of the forehead all the way down the nose. So this is really great for opening up the back and the spinal cord, causing your nervous system to be able to transmit energy and communication much faster and easier. Point 103 is right in the center of the forehead. This is a point for your mind. You want to work this point because your mind is probably going all the time, 24/7. And if you have that brain fatigue where your brain is just constantly thinking and trying to do, this is really good for turning that off, particularly if you're noticing that you have some anxiety. A lot of times when you get pregnant, you can have a lot of anxiety because you hear, don't do this, don't do this, don't do this, don't eat that, don't do this. And a lot of times you think more about those things you can't do than the things that you can do. Okay, going down a little bit further, we have point 106. This is a great point for activating your intuition. So you intuitively, your body knows what's good for you. It knows what it wants. It knows what's going to keep it healthy. But a lot of times we turn off that intuition when we're stressed, when our mind is going crazy or things like that. So this is helping to increase that intuition and also producing the really powerful antioxidant melatonin, which is also an antioxidant that helps you to sleep better and more restfully. And when you're sleeping better and more restfully, it's also allowing your body to heal while you're sleeping. So super important point to work. Coming down to 26, which is right between your brows. This is a point for your stress response system, your HPA axis. So balancing this out helps your body to know which chemicals and neurotransmitters and hormones to release at what point. And so this is a very important point to work on a regular basis. This is also a hormonal regulation point, which is going to be really helpful for knowing when your body needs to produce breast milk and all those other things that keep your baby healthy and happy. Coming right between the eyes, we have the point for point 8, which is for the heart. This is obviously going to be very much necessary for circulation. You want to make sure you have good blood flow going through the placenta to your baby, making sure you have good circulation. Coming down a little bit further, we have a point for the diaphragm. This is going to be really, really helpful, particularly in your 3rd trimester. As that baby is growing and coming up closer to your diaphragm, you're probably going to feel shortness of breath, feel like you can't take full breaths. So working the diaphragm point is really going to help you to be able to take deeper, fuller breaths, even with that baby taking up more space in your abdomen. Then just continuing your way down to point 1. This is not quite to the tip of the nose. It's right in here. Point 1 is a point for the blood. This is about filtering and enhancing your blood so that your blood is healthy for you and your baby. Also a great point for the low back. So as your baby begins to grow, it's going to put stress on your low back. You might feel like you have more low back pain or more discomfort with sleeping or relaxing. So this whole area of this lower nose is really, really good for low back and hip pain. Sometimes when you're pregnant, you get some sciatica pain, and so this is an area that you can work for that as well. This isn't on the diagram or on the face map, but just know that you can work this whole area. You can just work this whole area coming up onto the nose as well. In addition to this being the back, this is also the place for the uterus. So working this area is going to help keep your uterus nice and nourished and energized so that it's providing nutrition and a safe place for your baby to live. Okay, then we're going to come to the left side of the face. As we work coming down in here, you can also work this left side of the nose here for heartburn. So this is a point for the esophagus coming into the stomach, which is right in here. The stomach is super, super, super important during pregnancy because the stomach nourishes all the muscles and gives you energy. During your 1st trimester, especially, and then coming into your 3rd trimester as well, you might notice that you have very low energy, like you feel like you need to sleep or nap a lot. That's just your body telling you that it is growing a baby and it needs some extra energy. It needs some extra rest time so that you can help to grow this baby. So when you feel tired, when you feel exhausted, make sure that you take that time to rest. As you move over just a little bit more and up a tad bit, you get the spleen point. And again, that spleen is about making sure you have plenty of red blood cells, plenty of hemoglobin, which delivers oxygen to yourself and to your baby. Again, that spleen is the mothering organ. It is about providing nourishment to yourself and to your baby. So make sure you're working those points on a regular basis. Then you can come up to right beneath the eyes here. This is point 73 for the breasts. If you find that you have tenderness in your breasts, or as you're getting closer to your due date, you can really enhance your breast milk production by working this point. And this point specifically along with that stomach point is very helpful. And then coming over to the side, we have point 60, which is going to be great for circulation and really good for releasing the hormone oxytocin, which helps you to bond with your baby. Also really good for enhancing breast milk production as well as you're improving circulation. Additionally, this point can be really good for helping you with sleep and helping you to get more restful sleep as well. Moving on to the right side of the face, we're going to work our liver point. So in line with the bottom of the nose, directly under the iris of the eye, and working slightly upward, we have the liver. The liver and the gallbladder, which is right beside it over here, point 41, are super important points because they break down the fats that you eat. When you are pregnant, you want to make sure that you are eating plenty of delicious fatty foods, particularly meat, red meat, butter, maybe avocado oil or olive oil, things like that, because you need those vitamins A, D, E, and K, plus a lot of saturated fat to grow your baby's brain and spinal cord. Really, really important. If you are vegetarian, make sure you're eating a lot of eggs because you really do need that cholesterol and that saturated fat for your baby's nervous system development. If you're vegan, I would highly recommend that you give up veganism during your pregnancy just because of the fact that your baby does need so much of the saturated fat. It's very difficult to get that from a vegan diet, especially when you're pregnant. And then you can always go back to that after your baby is born if that's important to you. But it is something I would definitely consider. Coming under here, working underneath of the eye, again for that breast area, enhancing that, relieving soreness in the breast, sore breasts, and then also helping to enhance breast milk production. And then coming over to the side of the eyes. And this is for circulation, releasing oxytocin to bind with your baby, and also helping with sleep. Particularly if you have any sleep apnea or snoring or anything like this point can be really helpful. So now we'll talk just a little bit about the area you want to avoid. The main area you want to avoid is this whole upper lip right in here, and the specific area is right here. This point is called the ejection point, and it is a point that you do not want to work while you're pregnant because it is a possibility that it could trigger labor. If your body is completely healthy and everything is going well, you're not going to trigger it by working this. So if you accidentally work your upper lip here or there, it's not going to be a big deal in most cases. But you just want to avoid this area because it has that possibility of triggering labor. Now, once you are close to 40 weeks, you can start to activate this point. And your body, when it's ready, may help it to activate labor. And when you're in labor, it will actually help your body to have more effective and less painful contractions as well. So while you're in labor, I would definitely keep working this point here and there, helping that labor to progress along, and then also helping to decrease those painful contractions. The other areas around here that I don't really have on this map, these are areas you'll want to work a little more sparingly. The areas above your nose and cheeks and above are free game. You can work that almost as much as you want to. I would try to do that probably on a daily basis or at least a couple times a week. This area you want to avoid. The area under here, this can be related to like your cervix and lower reproductive system. You can work this somewhat, but I wouldn't overwork it because we don't want to really be stimulating that cervix too much, but you can work it a little bit here and there. I would say just working this area here maybe once or twice a week will be plenty. or you can avoid it completely if you feel better about that. But congratulations on your pregnancy. And just remember that being pregnant is a condition of health. Don't be so worried about it. In fact, the less you worry about it, the more you take care of yourself, the more you rest, the more you decrease the stress in your life, the better off everything is going to be, and the faster you're going to recover as well. Thank you for watching. I will see you in the next video.